Hi everybody, thanks so much for joining us today. My name's Maddie Leather and I'll be hosting this webinar series for Nottingham City Council, where we'll be sharing the findings of our JSNAs, which stands for our Joint Strategic Needs Assessments. So just quickly to give you guys a sort of idea of what the session's going to look like, before we go, sessions are recorded and the edited recordings will be available online, which means there won't be that bit where my dogs were crying at the door, which is great for me. All of your cameras and mics are off, so you won't be able to be seen or heard, but we do have the live Q&A function on. So please do ask questions as we go along. We'll be addressing them at the end of the session, but we'll see them. And if you see another question that you're really interested in, or if you have the same question as somebody else, then you can upvote that question so it moves to the top, so we'll be able to see which are the most popular. If there are any that we don't get through, then we'll be sending out a post-webinar pack for people. So please don't worry if your question doesn't get answered today. We will still make an effort to answer your question. But thank you all so much for joining us. If you are interested in some of our upcoming JSNA webinars, then please make a note of my email. I've got that again at the end of the presentation for you all. And please let me know. I'll be talking about what those different webinars are, so you might be interested in certain ones and not others, and that's fine. So today you'll just have 10 minutes from me, first of all, about what a JSNA actually is. Then you'll have 20 minutes with Bryony, who will be talking about what the findings of the Work and Health JSNA were. You'll have 10 minutes for you guys to give comments and questions, and then 5 minutes just for me to tell you what's coming up and to close us up. So I planned for 45 minutes, so hopefully we won't run over too much, but I thought if we did, then you'll all be gone within the hour still. So first of all, what is a JSNA? So it stands for Joint Strategic Needs Assessment. I didn't know that when I started working in public health, so don't worry if you don't. It's a statutory duty, which means that it's something that we in public health are required to do by law, and it helps us to better understand the current and future health and well-being needs of a population. So there are JSNAs available around people seeking asylum, refugees and people refused asylum, for example. But as well as populations, it might also look at certain behaviours. So we've got ones on substance use and gambling. And also they can be focused on the context, like the one we'll be talking about today, which is on work and health. So they aim to support the planning and the strategy that happens higher up in terms of supporting people's health. So once we've identified what the health needs of a population are, we make generally, not always, but we generally make recommendations that should support planning to make sure that whatever population we're looking at is getting the support that they need and that any gaps in services are being filled and things like that. So it really helps to shape those services, to guide sort of where those services are offered and what that service looks like, and also to improve the services that we already have as well. And really, really importantly, JSNAs give a really local picture. So we might have sort of a national understanding of what women's health looks like, but we need to look more carefully at the local level to see what it's like in Nottingham. And it's not always the same as it is everywhere else. So before, we used to write what we called JSNA chapters, and I will be sharing the slides afterwards, and these are sort of active links that you guys can click on if you want to go and have a look at these. So previously they were what we called JSNA chapters, which were quite weighty, big pieces of work with lots of text in. And I think it's fair to say that they weren't always that accessible to everybody, and lots of people didn't feel able to sort of interact with the JSNAs in this format. So more recently, we've tried to make them more accessible by moving into this like profile format. And that's really supposed to be easier to digest. It's supposed to be much shorter. Have a few more visuals in, and we try and have quite an important like sort of summary on a page. So again, the link for this particular one is available on the slides, and this is a really good example that we have, which is our people seeking asylum, refugees and people refused asylum JSNA. But as well as that, we've also got our JSNA dashboards, which my little team that I work within public health have developed with the support of people from county as well. And these are, I think, really cool because I'm a data nerd. But the aim of these is to really allow you to have a look at the data that we have and to ask the questions and answer the questions that are most interesting or relevant to you. So rather than sort of in the profiles and the chapters where we've picked out the key information that we felt was likely to be the most useful or likely to be the most important, this really gives you access to everything. So that you can pick out at what level you want to look at things, how in depth you want it to be, what particular factors. And there's a number of these dashboards available for you to look at. So this, I believe, is our health and wellbeing one. But we also have one on like children and young people, for example, that you could take a look at as well. So who can use a JSNA and how? I'm not going to go through this in loads of detail. There are different ways that different people could use a JSNA. So I've mentioned policy and strategy makers already. Commissioners, I've mentioned how the JSNA can help to identify gaps in services and ensure that effective services are continuing. There's lots of relevance for service providers and health professionals of understanding the health needs of populations, but I want to draw your attention to the sort of community and voluntary sector organisations. So these JSNAs should be really helpful for informing grant applications. I used to work in the community and voluntary sector, so I know how important that is to be able to evidence the need. And these should be really helpful for that. And they should help to understand that need at a local level and to help those organisations to know maybe, what's needed, what they could be providing, where commission services maybe aren't filling gaps, etc. For the individuals from the population under study, we hope and believe that the JSNAs support people to be able to self-advocate. So to be better able to go to a doctor or a service or a person or an employer and say, actually, people in Nottingham who are like me are experiencing X, Y, and Z, and we really need that. And that's a really important recommendation. But there's also the opportunity for people to look at the JSNAs and see what good local services and support are available. And it provides them with the opportunity to really just have their voice heard in terms of what their experience of being from that population is as well. So there's lots of opportunities for different people to get involved, including local authority colleagues from other departments other than public health, who might want to sit on steering groups, help with recruitment, support with the actual writing of these, mapping of services and making sure that we can really get the information out of there. Health colleagues might also sit on steering groups and support some similar things as well, but might, really help us to have a good oversight of a project and the needs. Providers can really help us to recruit and to share the information with others. The education sector could help us loads and loads, and we like to think that this would be a mutually beneficial arrangement as well. But we will particularly value support with things like ethics, data collection, data analysis, and dissemination. And that will provide opportunities potentially to students as well as staff from the education sector. Again, community and voluntary sector are always really helpful for recruitment, helping us get participation and getting the word out there. And the same is true really for individuals from the identified population, also their families, loved ones, carers, etc. And there are also sometimes opportunities for people who are experts by experience to sit on steering groups as well. So I will hand over to Bryony now, if you are ready, to talk you through the findings. Thank you.
Thanks, Maddie. So as Maddie has wonderfully introduced, we're going to talk to you today about the findings from the Work and Health Joint Strategic Needs Assessment. So this was conducted over the summer and presented to Nottingham City's Health and Wellbeing Board in September for approval. So it has been published for a couple of months now, but really want to give the opportunity for you to find out a little bit more about the key findings, but also an opportunity for you to ask some questions or make some comments. As Maddie introduced, my name's Bryony Cornish. I'm a Public Health Manager in Nottingham City Council's Public Health team. I've led on the writing of the JSNA with the help of many colleagues who will be on the call today and those that aren't. Joe Williams is also on the call. He's one of our public health registrars and is working on the delivery of the work and health priority within the joint local health and wellbeing strategy, which I'll come on to in later slides. So first slide, please, Maddie. Thank you. So first of all, why is work and health important? Why did we feel that it was important that we conducted a JSNA on this topic? Well, we know that being in work has benefits for health and well-being. It provides financial stability, it provides access to healthcare and benefits through occupational health services or workplace pensions. It provides people with identity and purpose, offers social connection, and improves mental health and well-being. We also know that good work in particular helps to meet core social, personal, and psychological needs, and that access to good work is a building block of a healthy life and a healthy society. On the other hand, we know that unemployment and economic inactivity has negative outcomes on people's health and well-being, and in particular, depression, anxiety, and musculoskeletal conditions are increasingly keeping people out of work. They're the two, mental health and MSK are the two main reasons why people are out of work due to ill health. We also know there's lots of contributing factors to inequalities. Sorry, Maddie. Contributing factors to inequalities in health and work outcomes, which we'll explore a little bit further in later slides. So thanks, Maddie. So very conscious that some people on the call might not be familiar with JSNAs, hence why Maddie did some introductory slides, but also wanted to talk you through sort of the process that we took with this JSNA in particular. So the first thing that we did, and that actually took a lot more time than perhaps we envisaged, was really ironing out the scope. So deciding what was and wasn't to be included within the JSNA. We had to think about what was reasonable to cover in the time that we had to review the real breadth of evidence that is already out there around work and health, to collect new qualitative feedback from citizens within Nottingham City, to analyse data, and to work with partners and stakeholders to make sure that they had input into the design of the scope and the findings that the JSNA presented. So a big thank you to colleagues from Economic Development, the Integrated Care Board, and other colleagues from wider public health that had input into this via the steering group. We then had to put requests into our data analysts, who helped us to analyse the wide breadth of data sources that were available to us. They helped to explore those data sources and apply it specifically to the Nottingham City population. Collectively, we mapped local assets and services with the help of many other colleagues to understand the local, national and regional programmes that are in place to support people into work, to stay in work or return to work after a period of illness. And finally, we conducted a series of focus groups and a survey with stakeholders to better understand the specific needs of people and organisations within Nottingham City. So this, combined with sort of a comprehensive review of the research and evidence that already existed in this space, forms really the bulk of the content of the JSNA. We're going to give you a really whistle-stop tour of the findings, but I think just encourage you all to go away after this and read the JSNA profile in full to really understand the detail. Thanks, Maddie. So as I've mentioned, took us a little while to really nail down the scope of what we wanted the JSNA to explore. In essence, the bullet points at the top there are some of the key topics that we wanted to look at in more detail. So we wanted primarily to define what unemployment and economic inactivity meant in the context of health. We wanted to better understand the relationship between health and work and really understand how that is bi-directional. So health impacts work and that work impacts health, but in what ways? We wanted to look at whether there were some employment types that were particularly at risk. So were they susceptible to higher rates of economic inactivity due to ill health? We wanted to explore the sort of access, retention, and that flow of people in and out of work due to health conditions. So the time periods that people are off work for and how that might impact their return to work. We've mentioned it already, but we wanted to really explore the role of employers in providing good work, what that means, what that looks like, and how we can encourage employers in the city to do more of that. I've mentioned mapping already. We've also looked at some sort of spotlight areas of periods of time throughout someone's working age life where their experience of work and health might be different, and I'll come on to that a bit later. And then finally, we wanted to look at understanding what works for people that are furthest away from work due to ill health to re-enter employment. So looking at the evidence base for tailored interventions and what's deemed most effective. So as we've already sort of alluded to, we had to refine the scope before delving into the depth of the research and evidence and data that already exists. But we set out to explore the following key objectives on this slide here to better understand the role of work and health in the city. Next slide, please, Maddie. So going to give you a very quick overview of some of the data that we covered and that we explored within the JSNA, very much a snapshot. So we do encourage you, as I've said, to take the time to read the full supplementary material to get a fuller picture of what the data tells us. We also want to caveat that the reasons for why certain percentages might look different depending on the data source, and this is because data sources generally within work and health use slightly different populations. So some include the 16 and over population, which obviously includes those that are retired, which slightly skews the data and makes the percentages of those that are economically inactive due to ill health look smaller. And again, students are often included in these data sources, which can also skew the figures slightly. So just bear that in mind when I'm sort of talking through the data and how you interpret it in the report. So this first slide looks at total economic inactivity and economic inactivity due to ill health. So whilst total economic inactivity has fallen in line with the East Midlands and England rate in the last year, economic inactivity due to long-term sickness in Nottingham is still higher than regional and national trends. Being long-term sick is the biggest reason for economic inactivity in Nottingham amongst the working age population, and that's actually higher than being a student. So often we assume that the biggest reasons for economic inactivity is being a student. In Nottingham, the reasons are that people are experiencing long-term sickness and ill health. Thanks, Maddie. So we also look within the JSNA about the real local picture and what economic inactivity looks like even at ward level within the city. So between wards we see large variation in the reasons for people's economic inactivity. So for example, 82% of economic inactivity in the Radford area is attributed to residents being students, compared to Woollerton, for which 63% of economic inactivity is attributed to people being retired. The rate of economic inactivity because of long-term sickness varies greatly across the wards. The map on the right-hand side shows the proportion of people aged 16 and over who are economically inactive due to long-term sickness or disability out of the entire population. And that shows that wards such as Bilborough have 10.5% of its total population economically inactive due to ill health. And other areas where this is high include Bulwell, Bestwood, Aspley and Clifton East. Thanks, Maddie. Finally, in terms of data and evidence, the rate of economic inactivity due to long-term sickness or disability for Nottingham is similar to many of our NHS statistical neighbours. So their statistical neighbours are deemed to be areas that have similar population traits to Nottingham, so it makes it easier to compare. But we are higher compared to the England rate of just 4.1%. And on the right-hand side, the latest available data shows that Nottingham has a 6 percentage point gap in the employment rate from those between those aged 16 to 64 with a physical or mental health condition compared to the overall employment rate for this group. And again, that's lower than both the East Midlands rate and England's rate. Thanks, Maddie. So the JSNA also provides a full summary of the key policy and guidance, as well as a comprehensive review of the evidence. We also reviewed the relevance of several local and regional plans, which you may or may not be familiar with. So the Get Britain Working Plan, which the East Midlands Combined Authority is currently leading on, how this fits within the Nottingham Joint Health and Wellbeing Strategy, but also looking at policies and plans within economic development. So the Nottingham Economic Plan for Growth and the Inclusive Growth Strategy all have relevance and mention health within those policies. But what the policy and guidance has essentially told us in sort of a very quick summary is that Tackling an economic inactivity requires a move from a reactive focus on sickness to a more proactive approach, which emphasises prevention, early intervention, and the promotion of good work via a whole systems approach. So the evidence that we've explored really emphasises the importance of good work and how systems can work together to better health outcomes for those that are in work and work outcomes as well. Thanks, Maddie. So as I mentioned at the beginning, we also did some community engagement, explored some qualitative avenues of gaining knowledge and insight around the lived experience of people within Nottingham. So we conducted 3 small focus groups, only 9 people that attended those focus groups, so very conscious that it's not necessarily generalisable to the entire Nottingham population, and we will be looking at how we conduct further engagement. But what these people told us was really vital in understanding their experiences of managing work alongside a long-term health condition or disability. So they told us that work is really important for making them feel like they had purpose, that they had social connection, but they also gave them financial stability, and that was really important for looking after their health and well-being. They really advocate for the fact that they can really thrive at work with the right support and workplace conditions. The fact that they have a health condition shouldn't be a barrier to them being able to be their most productive and supported in the workplace. Their view was that services should be flexible, they should be easy to access, and that they should offer tailored and in-person and person-centred support, which many of our services do. But they really highlighted as well some of the barriers that they experienced to accessing good work with their health condition. So they highlighted things like inflexible workplace policies, repeated requests for workplace adjustments, discrimination, stigma, a lack of understanding, and that tendency for workplaces to apply a one-size-fits-all approach to supporting people with health conditions. And that holistic care is really necessary, including that support to manage their health condition, to access things like mental health services or money help, and that employment support as well. Thanks, Maddie. I've also mentioned already that we have explored within the JSNA some key spotlights. So within our discussions early in sort of the planning of the JSNA, the steering group established that experiences of work and health are really shaped by factors such as age, stage of career, health status, and societal expectations, and that across the life course there might be different times in which certain challenges impact someone's ability to achieve good health and work outcomes. This is not to say that those experiences don't occur at other points in someone's working age life, but they are worth considering when working to support people back into work for the first time. Again, in the profile, we explore these in more depth. So we look at mental health and neurodiversity in younger working age adults. We look at the impact of co-occurring long-term health conditions and menopause in working age adults sort of 40 to 55. And then we look at the impact of dual caring responsibilities in those working age adults that are starting to approach retirement. So those that might be having to care for children, but also aging parents as well, and the impact that might have on people's ability to thrive at work, but also the impact on their own health and well-being as well. Again, in the profile, we explore all of these in more depth, and we pull together some of the most relevant research and evidence behind these issues and the impacts that they can have on people's work and health outcomes. Thanks, Maddie. Another key element of the JSNA is to look at the assets and services that exist within the city to support positive work and health outcomes. What we really knew was that there was a complex landscape of support services in the city, but that also regional and national programmes exist and are designed to support those transitions into work for people with health conditions. In the city, these services look like individual placement support, but also focus on the important role of voluntary and community sector organisations and the support pathways that help people navigate these complex systems. Health and care also has a really important role to play in initiating conversations about work and health and signposting people to the right support in a timely way. We also asked our library services to conduct an evidence review of what makes interventions to support people with health conditions into work most effective. In brief, the evidence suggests that interventions need to be individually tailored, holistic, flexible and sustained, integrated with health and employment services, and engaging actively with local employers. But we, again, provide a lot more detail on this in the supplementary material within the JSNA. Thanks, Maddie. And then just on assets and services, again, this is a map of the local assets that we have in the city currently and the sort of things that are in the pipeline or are expected to land in 2026. This includes schemes and services for individuals, but also support for employers to help them provide good work. We know we've probably missed parts of this jigsaw, so we'll be doing work with county and regional colleagues to understand this further over the coming months. Thanks, Maddie. So finally, the JSNA culminates with us establishing firm recommendations based on all of those needs that are identified. Specifically, we've picked out 5 core opportunities for improvement and future development. The first of which is formalising referral pathways and embedding conversations about work and health into routine health and care appointments, helping to ensure that people access timely support as soon as they are first off work. The second is around engaging with anchor institutions and local employers to promote good work. So that includes things like reducing stigma and discrimination that's associated with long-term health conditions and disability. We want to align with local plans, so those that are led by East Midlands Combined County Authority, but also our colleagues over in county, and lead that cross-sector collaboration. We want to improve communications to professionals and citizens and inform sort of targeted outreach to in-need groups, specifically with the aim of increasing visibility and accessibility of services. And finally, we want to use data and evidence to help us prepare for the future, so routinely monitoring trends and emerging needs and exploring additional research opportunities. So these recommendations have informed the local delivery plan for work and health, which, as I mentioned at the start, is a priority in the Nottingham City Joint Health and Wellbeing Strategy. This work has backing to continue over the life cycle of that strategy, meaning hopefully we can work towards making meaningful change for citizens of Nottingham, but we need your help. So on the next slide, we also have some great opportunities for collaboration in this piece of work, and I know there's lots of colleagues from different partners on the call, so this is a little bit of a shout out, but an opportunity for you to use the JSNA and its findings in your own work and taking it back to colleagues and sharing what you found or what we found and what you've learned. So there's plenty of opportunities for you to collaborate and provide input into this work. As mentioned, the Joint Health and Wellbeing Strategy has a priority around work and health and is being led by a strategic partnership coordination group. If you think you have a place at that table and you want to contribute to those discussions, then please do get in touch with myself or my colleague Jo. The JSNA also really recognises the important role of anchor institutions, which are typically those much larger public sector organisations who have a real input and influence over the well-being of the populations that we all serve. So people like universities, NHS trusts, local authorities, they really have the opportunity to lead the way in providing good work, but to also influence their supply chains and employers that are connected to those. For you in particular, the JSNA can act as a valuable source of local data and evidence. So we ask you to refer to it when writing proposals or considering service changes, and remember it is there to offer insight that is local to Nottingham. There will also be opportunities for you in the new year to commit to the Good Work Charter, which is led by colleagues in economic development. So a plea to please look out for this and help lead the way in being a role model for other employers in Nottingham. And just finally, we're also looking to gather further qualitative insights and would welcome your thoughts and feedback when the time comes to contribute to additional co-production of services or wider programmes of work. And sorry, one more point around healthcare or voluntary sector professionals, we're also exploring ways to improve knowledge and understanding of professionals in those roles to have productive conversations about work and health with service users or patients. So again, a bit of a watch this space and look out for future training opportunities. I think I've got one more slide. So just a thank you for listening. As we've said, there's an opportunity now to ask questions or make observations about the findings of the JSNA or about the process of JSNAs in general, which is what Maddie spoke about at the beginning. Q&A functions there for you to start adding questions to that. When we send out the slides, these links will be available, but there is the opportunity for you, as I've said, to read the full JSNA profile on the Nottingham Insight webpage, and there's embedded links within the profile which will take you to the supplementary material if you want to read in a bit more further detail. So thank you.
That's brilliant. Thank you so much for that, Bryony. So this is also your slide. I'm going to open up the floor. I haven't been able to look yet about some questions because I'm sharing the slides, but our very helpful and lovely colleague Jo, who's been supporting Bryony with this, is going to lead the questions, I believe.
Yeah, we do have one in. I can't ask Melanie to read this out because of the settings that we have on there, but I don't think this is actually one for Bryony or Maddie, but it's a kind of wider one looking to draw on some of the other participants that we've potentially got here. So this is a question from a Ministry of Justice contact. I'm just going to read out her question, and if anyone else is able to see this or to respond to it in the chat, then please do if you've got any ideas for Melanie. She works helping ex-offenders with employment opportunities when they come back into the community. A lot of the participants suffer with mental health and confidence issues, and she's struggling to find open-minded employers. These people are really keen to get into work. So I don't think this is aimed specifically at you, Bryony or Maddie, but anyone who works with employers, or if there are any employers on this webinar who would be able to assist with candidates in this kind of position. So Bryony, Maddie, if you've got any thoughts on that, if anyone else is able to give a response to Melanie, perhaps you could add that into the chat function. Any contacts, any suggestions of specific employment support providers? Bryony?
Thanks, Jo. I suppose my one thought is around the Good Work Charter that our colleagues in economic development are leading on. So that is an opportunity to engage with employers within the city, and that's something that we can explore with them in terms of their openness to recruitment and inclusive recruitment. So perhaps one that we can take back to colleagues in economic development. I think a few of them are probably on the call, might be able to add something to the chat if they think that's appropriate.
Yeah, thanks, Bryony. And yeah, please do add a bit more, call others if you're listening in and want to add a bit more detail about the forthcoming Good Recruitment Hub or Good Work Charter. We've got another question in the Q&A. Thanks, Richard. Asking about the JSNA process. Does it contain any reflections on trends or needs around young people who are not in education, employment or training? So I'll go to you on this one, Bryony. The ability of young people to make the transition from education to employment is something worth considering. I just wonder if you could tell us a bit about the scope and what we looked at in this.
Yeah, definitely. I probably skimmed over it in one of the earlier slides in terms of what was out of scope within this JSNA. So just bearing in mind the sort of short turnaround time that we had to complete the JSNA, we did have to consider what wasn't in scope, and that did include those that are not in education, employment or training. It also included things like volunteering. Not to say that those issues aren't really important considerations when thinking about work and health, but will be explored through other routes. And I know there's definitely consideration for those population groups within the delivery plan, which has been born out of the recommendations within the JSNA. Hopefully that answers the question.
Thanks. I can see some really good input on the connections being made using the chat. So that's a really useful way of making the most of a lot of the range of people and organisations that we've got.
Yeah, so I have a question for Bryony. As you know, Bryony, I work on women's health, and I saw that the menopause came out as like one of the challenges that people are facing. I'm just curious what sorts of things actually came out in terms of what women who are, well, women and or people who are experiencing the menopause, like how they could be better supported at work, because working in women's health, I get a lot of questions about that.
Yeah, so we really explored the sort of evidence that suggests why women might experience challenges at work when going through the menopause, and a lot of that was born out of sort of a misunderstanding of what symptoms of menopause are and how that might impact women's ability to be productive at work and the accommodations or the workplace adjustments that they might need. So I think a lot of the evidence points towards better support from employers, and that includes sort of knowledge, understanding and training around understanding the menopause and how that impacts female employees. Thanks, Maddie.
Thank you for that.
Bryony, can I ask a question, please, as well? Just firstly, thanks both for sharing about what these pieces of work are generally and what they're trying to do, and then what the specific one has done. And I think I often think of these as big data exercises, and I was really interested in how you'd helped us to think about what this might mean for people who work locally. But I wondered if I could just ask you a bit more about the focus groups element of it, and just if you had any reflections on how that part of it went, and also if you would have been able to do any more focus groups, what kinds of things would you have done, and who would you have liked to have spoken to in terms of getting other views?
Yeah, definitely. So we had, given the short time that we had to conduct the focus groups, we were really pleased with the number of participants that volunteered their time to come and speak to us. A lot of the participants obviously had experience of health conditions. Most of them had health conditions that were probably deemed to be invisible. So we didn't necessarily have people with visible disabilities. So definitely in the future, we'd like to speak to a broader range of people with long-term health conditions and disabilities to really understand how those different conditions might impact people's experiences of work and health. We had quite a spread of people that were both in work and currently out of work due to long-term ill health. So, got a good idea of the impact of support services, whether that's in work through your employer, but also being out of work and looking for support to get back into work. So that really told us about the support services that are available locally, but also the things that work really well within workplaces and the support that is best provided by employers to help people with long-term health conditions. So although the focus groups were small, they gave us a huge amount of insight as to people's local experiences of work and health. But I think there's definitely a lot more that we can explore to understand sort of barriers to employment and perhaps the experiences of people from wider groups across Nottingham.
Thank you. Again, just want to say thanks to the participants who are making some really useful connections. I can see our economic development colleague Paul is linking in about the good work, good employment hub. Sorry, so thanks Paul on that. Has anyone else got any other questions that they'd like to raise specifically about this piece of work? I know Maddie's going to tell us about some of the other topics that the teams are going to be exploring. But just before she does that, has anyone else got anything that they would like to flag either through the chat function or the Q&A?
Just whilst we're waiting to see if anything comes in as well. Oh, I can see one has come in, but also if people do have sort of burning questions for myself or Bryony afterwards that you'd rather email us, please do feel like you can do that, and we will be sending out the post-webinar pack, like I say. So if you think of a question that you think might be useful for everyone and you get it to us before then, we'll be able to deal with that. So Joe, you're doing such a good job. I'll leave you to...
Well, no, it's okay. We have had an additional question come in that was focused on carers, Bryony, can I give that on to you? So I know you have, that is something that you've given a bit of thought to in terms of the data.
Yeah, so
and then if
sorry,
you could respond to that one, please.
Yeah, so we look specifically within the JSNA at the evidence around how the impact of caring, what the impact of caring is on people's own health and well-being, but also how that impacts their work outcome. So we do see people falling out of work due to having to pick up additional caring responsibilities, but also because of the implications of needing to take time to care, and the mental health and well-being impacts of that additional sort of demand on people's time. So the evidence within the JSNA expands on that a little bit more, and I think within the delivery plan of the work and health priority, I think we'll definitely be looking at, you know, how that forms one of our perhaps target groups in how we support that specific group back into work, or to manage work alongside their caring responsibilities, as well as looking after their own health and well-being as well.
Thanks, Bryony.
Thanks, Jay.
We've had so an additional question, a couple of things that I think are probably related actually. One is about being able to access the JSNA in detail, but that's related to that is a question in the chat about data sources and whether those are listed, and I know you will be able to respond to that, Bryony.
Yeah, so there should be some citations on the slides that are sent out for the data that I presented today, but in the full JSNA profile there is an additional reference list as well, so you can look at all of the data sources that we've pulled from. The majority of data comes from NOMIS or Public Health's fingertips tool, so it was a bit of a combination of data sources that we've used, and then in response to the question about where you can find the JSNA, it is all on Nottingham Insight. So if you just Google Nottingham Insight, redirect to the Joint Strategic Needs Assessments page, and then you'll see work on health on there, as well as a range of other JSNAs as well, which I'm sure Maddie will tell you more about.
Thanks, Maddie. So I can't see any more questions about the work and health stuff. So thanks very much for presenting it to us and to responding to the comments. Maddie, over to you.
Thank you. Can't believe I've managed to get that up at the right slide without any trouble. Just having a little bit of loading. Yeah, so just wanted to quickly let people know what JSNAs we have coming up in case you want to look out for the findings, look out for the webinars, or maybe get involved in actually like helping shape what that JSNA looks like, or contributing as a participant, perhaps by answering a survey or taking part in a focus group. So there's one upcoming of my very lovely colleague. Do you know what? I'm not going to say they're all very lovely, but they are. My very lovely colleague, Claire. So if anybody is, that's a joint piece of work with county. So if people are interested to support with that, please let us know. There's an ongoing piece of work around food security and sustainability, healthy weights, all age alcohol related harm. I'll be leading on a health needs assessment probably, which is slightly different but similar, around LGBTQ plus health and how we're going to separate that out, whether we're going to maybe look at people whose gender identity differs from that which they were assigned at birth separately to people whose sexuality is not heterosexual. We're not sure yet, but something around that coming up. Inclusion health, which this is like a real test of how much I listen now, which I believe includes people in contact with probation, people from the Gypsy Roma traveller community, people who have been victims of modern day slavery, sex workers, and then people experiencing severe and multiple disadvantage, which involves sort of a combination of different challenges happening at the same time. One around adolescence, which is quite far through now, but there might still be some scope to maybe participate in that. So that's 11 to 19 years with a particular focus on the transition between children's and adult services. And particularly focusing on mental health services. And then also, I know that Katie's actually on the call, so my very lovely, again, colleague Katie Fagan has done, and JSNA, just sort of in the end stages of a JSNA on adults with learning disabilities. So that will actually be coming up in, we think, probably March time, if anybody thinks that might be interesting or have relevance for them. You can see here, I popped the link to Nottingham Insight, which is where all of our JSNAs can be found. They're not organised in the best way possible, but that's sort of, we're looking at how to reorganise that. So if you do see anything on there that you think you have some feedback about how that could be easier to use, please do feel free to drop me an email. And also, if you're interested to be added to the mailing list for any of the upcoming webinars, either generally or specific ones, please let me know, drop me an email and I can add you to that as well. Apart from that, I just really want to thank everybody for coming along. I really hope that this has been useful and interesting. And I'll be sending out the post-webinar pack that I think I've mentioned about 6 million times throughout the call now, sort of as soon as possible. So that should be coming this week. Bryony, Joe, do you have anything you'd like to add before we finish?
No, nothing from me. I think just thank you to everyone for attending. I'll put my email address in the chat before we finish as well if anyone has any further comments or wants to meet outside the meeting.
I will drop my email in the chat for people who are interested, just to make it easier for you.
There's a couple of hands gone up, and back down actually. So I'll just say to people, and thanks all for attending. If you've got additional comments to make now, if you could pop them into the chat, if that's feedback or any other point you want to make. And I'd just like to say thanks, Maddie and Bryony, for organising and telling us about the concepts of these pieces of work and really going through really quickly a lot of the work that you've done on this particular one, Bryony. So thanks very much.
That's brilliant. All right, see, I've given you all 9 minutes free on your schedule. You're very welcome. If that's not how to support your work and health, I don't know what is. Have a wonderful day. Please do email us and we'll catch up with you again. Thanks so much.